Dr. Ramanan Vadivelu. I'm one of the pediatric orthopedic surgeons from West Midlands in UK.
Medi Tales. Do like, share and subscribe to Medi Tales. Follow us on Facebook, Instagram, WhatsApp, Threads and X.
The importance of cerebral palsy and the children who suffer from it in India. Having a big population in India of 1.3 billion, there are nearly about 2.7 million patients of cerebral palsy cohort in the country. I think it's very important that it's everyone's responsibility to identify what problems these children with cerebral palsy face. Simple thing, for example, is about their hip problems. Most of the children with cerebral palsy have hip issues, and the hips can come out and cause problems, pain for them, and also problem for the carers to address them and how to handle them in their day-to-day activities. So I think it should be a collective responsibility of everyone to look into child's hip for assessment. It can be anyone, even the pediatricians or the community workers. If they find when they are moving the child's hip that they are in pain or in any trouble, it's quite important that they bring this to the attention of the medical specialties, especially the orthopedic surgeons. The child may need further assessment and may need x-rays of the hips to identify how far and what the problem is. So you can ask, why is this important? If you find out there is a hip problem in a cerebral palsy child, and if you address them early with simple surgeries or even with proper physiotherapy and orthotic support, that will be very beneficial. We can prevent and have the child having major hip problems later. If we don't do that, or if they get excluded, or if they are neglected, and when the hips do come out and have severe problems later, it becomes very difficult, not just for the patient or for the carers, even for the surgeons to treat them. It also has effects on the spine and also on the sitting balance in the wheelchair. So this is just one bit of it about the hips in cerebral palsy children. Similarly, they have problems with the feet and ankles as well. So when someone checks about the kids with cerebral palsy, the spine, hips and foot and ankle needs to be clearly looked at. This doesn't require any major specialist health. Even parents looking after the child, if they find that the child is not comfortable when they move the child's legs and the hips, it's important that they bring to their attention so that we can see and address them. A lot of issues with the children with cerebral palsy, hip problems and things, because when they suffer the brain injury when they are little, the signals going to the muscles are different. So some muscles overwork and some muscles become weak. So there's an imbalance with the muscles. This produces changes with the hips and the joints being in place, and that's what leads to the hips coming out and having problems with the cartilage and the hip joint itself. Lots of things are there, as I said to you before. Simple things which we can address is by physiotherapy in the first place, and some orthotic support and advice on how the child should be sitting in the wheelchair and what parents needs to look after. Even in a walking child who has got a little bit of cerebral palsy, it's important that we monitor everything. So it varies. If there's only very mildly affected, physiotherapy alone should be more than sufficient to, at least in the initial stage, to address them. But we need to keep an eye on it to see how they progress for later. So that's important. What I found here at the moment is there are a lot of children who do present in the late stage, what we call as literally burnt out stage. So we shouldn't be letting these things to go into that stage, because even the general practitioners or the doctors who see the child or the pediatricians who see the child before, if they can just be a bit mindful and say this child might have other problems, and if they refer to the correct or the appropriate orthopedic surgeons, we can work together to prevent all these problems for later.